Welcome to The Debate. Today we're tackling a really frightening and often misunderstood experience, the panic attack. We're talking about that sudden, intense rush of symptoms, both mental and physical. Things like a racing heartbeat, feeling like you can't breathe, chest tightness, and this really profound, overwhelming fear that you might be dying or, completely losing control.
And that suddenness, that sheer intensity, is exactly why it can be so debilitating. Now, while these symptoms feel absolutely terrifying, it's crucial to remember they aren't actually physically dangerous. They do pass, usually within maybe 5 to 30 minutes. The real problem often becomes the aftermath, this fear of fear, worrying about the next attack, where it might happen. That can severely impact someone's life, leading to avoidance, isolation. So figuring out how to interrupt that cycle is, it's essential.
Right. So our core question today really zooms in on that immediate crisis moment. What is the most reliable strategy, right then and there, for managing the absolute peak intensity of an active panic attack? I'm going to argue that strategies emphasizing intense external sensory input, grounding, rapid distraction, are really the most effective way to sort of short-circuit that immediate physiological panic response.
Okay, and I'll be presenting the case that methods centered more on controlled internal regulation, specifically things like structured breathing techniques and cognitive self-acceptance, actually offer a deeper and ultimately more sustainable way to de-escalate the attack and really build a sense of internal control over time.
So when a panic attack hits, the body is just flooded with these alarm signals, right? It creates that horrible feeling of kind of detachment from reality. The absolute priority, as I see it, has to be rapid de-escalation. You need to override the part of the brain that's just panicking. And I think the most direct evidence for this approach is using strong, immediate sensory input.
That reliance on a sort of external shock, it feels a bit temporary though, doesn't it?
Well, think about the mechanism. Techniques like grab something cold, drinking ice water, splashing cold water on your face. They don't just distract. It's a physiological thing. It provides a shock that can activate the mammalian dive reflex, stimulates the vagus nerve, which pushes the body towards the parasympathetic nervous system. It's like a rapid reset. And similarly, the very effective 5-4-3-2-1 grounding technique that forces your awareness away from the internal chaos, the panic symptoms, and onto concrete things in your physical surroundings. 5 things you see, 4 you can touch, and so on. This deliberate shift, I think, is the fastest way back to feeling present in reality.
I believe that while, yes, an external shock can definitely interrupt a moment of panic, true management, lasting management, it really requires restoring that internal physiological control. And I'd argue that relying only on external stimuli, it kind of limits the person, doesn't it? What if they don't have ice water or strong-smelling salts handy? The absolute core of the panic attack is often that feeling of rapid, irregular breathing and a racing heart. So the most crucial intervention, from my perspective, is to actively work to slow your breathing using deliberate practice techniques.
Which, let's be honest, is incredibly hard to do when you genuinely feel like you are suffocating.
Oh, absolutely. It speaks to the challenge, but we can't just ignore the power of regaining that control. Structured techniques like the 4-7-8 method, breathing in for 4, holding for 7, and then a long, slow exhale for 8 counts, these are vital. That extended exhale, that's the direct signal to your body that the danger is past. It actively helps calm the heart rate. And when you couple that with internal strategies like talk to yourself, repeating a clear, simple mantra like, "This is uncomfortable, but it will pass," or "I'm not dying," these provide a reusable internal toolkit, something you can use anywhere, anytime, regardless of your environment, to signal safety and regain control.
Okay, let's think about the mechanics right at the peak, though. Because the onset is so fast, so overwhelming, the person's cognitive capacity is, frankly, extremely low. Rapid sensory distraction directly addresses this immediacy. Running your hands under cold water takes almost no thinking power, right? Yet it can dramatically lower that emotional intensity by triggering that physiological override we talked about. Even just changing your scene, getting up and walking to a different room, or engaging in some light movement like pacing, it serves this purpose. It removes you from the potentially stressful spot and provides a rhythm that can sometimes help regulate breathing more naturally. It just seems less cognitively demanding than trying to remember and execute a specific breathing pattern when you're in the middle of sheer terror.
I understand the appeal of speed. I really do. But have you considered that maybe focusing only on rapid sensory change might fail to build long-term psychological tolerance? It tackles the immediate symptoms, sure, but maybe without challenging the underlying fear of the symptom itself. And while we know exercise is generally great for long-term anxiety reduction, you mentioned light movement. Well, acute exercise during a panic attack could potentially intensify the experience initially by spiking the heart rate, the very symptom the person is probably terrified of. By contrast, structured internal techniques like progressive muscle relaxation, or PMR, they actively work to reduce the body's physical tension, which is a huge part of panic. Tensing and then releasing muscle groups, it signals deep relaxation to the mind. This kind of internal mastery, I think, is essential. The goal isn't just to distract from this attack, but to empower the individual to actually self-regulate their stress response over time. And beyond just the physical, we really have to talk about the cognitive side, the value of acceptance. Simply naming the event, telling yourself clearly, okay, I'm having a panic attack and I know what this is, that's actually a powerful cognitive tool. It immediately reduces the perceived threat because you're reminding yourself, okay, this feels awful, it's terrifying, but it's not actually dangerous. Similarly, using cognitive reframing statements like realizing, wait, it's not this room that's the problem, it's the thoughts I'm having about being trapped in this room. These are crucial for longer-term recovery. These cognitive techniques, they move beyond just temporary distraction towards genuine acceptance and understanding of the experience.
I'd argue, though, that pure cognitive acceptance, while a worthy goal, it's often too difficult right at the peak of that fear state. I agree that self-talk is valuable, and identifying the attack definitely helps, but I think it's far more effective when it's grounded by a physical anchor. The 5-4-3-2-1 technique, for instance, isn't just simple distraction. It's really a form of intensive mindfulness practice. It actively redirects focus away from that high-intensity internal anxiety by forcing sustained attention onto concrete, immediate physical realities, what you see, touch, hear. This blend, this combination of structured mental focus that's anchored in physical reality, that seems like a significantly more reliable first-line tool than trying to engage in abstract cognitive reframing when your mind feels completely hijacked by fear. So looking beyond the immediate crisis, effective long-term management obviously reduces general anxiety levels, and learning to manage known triggers, learning to identify and track your specific triggers, whether it's caffeine, maybe alcohol, high sugar foods, or environmental things like big crowds or public speaking situations, that's absolutely foundational. And furthermore, engaging in therapies like cognitive behavioral therapy, CBT, is often critical. CBT gives people the tools to challenge those catastrophic thought patterns that fuel the panic in the first place, and it helps increase overall tolerance to situations that trigger fear.
I might frame that slightly differently. While yes, avoiding certain substances like caffeine and alcohol makes sense, they're known anxiety accelerants, I think the clinical evidence really points towards the necessity of exposure, not just avoidance. The source material we're looking at strongly supports exposure therapy. That means gradually and safely introducing yourself back into situations that cause worry to actually reduce the anxiety over time. That seems to contradict a focus purely on avoidance. And importantly, if someone is having regular, unexpected attacks which might indicate panic disorder, then managing the root physiological sensitivity becomes key. This is where medical interventions often come in, things like prescribed SSRIs or maybe targeted beta blockers like propranolol, which specifically work to slow down the physical symptoms like heart rate. These are often necessary alongside ongoing therapy to really address the underlying vulnerability.
So we've definitely explored two powerful philosophies for managing acute panic. On one hand, using that intense external sensory input for a rapid distraction and kind of a system reset. And on the other, engaging deliberate internal techniques for more immediate physiological and cognitive self-regulation. Both are clearly valid paths when you're facing this incredibly overwhelming experience.
Absolutely. I think the overall takeaway is that effective coping really involves developing a pretty comprehensive anxiety toolkit. And this toolkit should ideally include both immediate physical grounding tools like that 5-4-3-2-1 method or cold water, coupled with methods for controlled internal release like the 4-7-8 breathing, and that crucial self-reassurance.
Right. And that immediate toolkit, it really has to be reinforced by those longer-term strategies we mentioned, things like CBT, potentially exposure therapy, and definitely proactive trigger management to help reduce the frequency and severity of future episodes.
Ultimately, perhaps the most important lesson or goal is achieving that deep conviction that the symptoms, no matter how frightening they feel in the moment, are not actually dangerous, and they will always pass. There's clearly still more to explore here, particularly regarding the nuances of individualized treatment plans for people dealing with panic disorder.